So good evening, everyone. Welcome to our final in-person event for the chapter education year, our Leader Talks RCM edition, which is a very fitting close to our chapter's theme, Own Your Impact. Revenue cycle touches every part of healthcare, from financial sustainability to patient access and experience, making conversation like tonight more important than ever. I'm so excited to have tonight's discussion and want to give a huge thank you to Akash and his team for hosting this incredible event. Thank you so much, Adonis. Akash is a respected healthcare finance and revenue cycle leader known for his strategic insight and industry expertise. Thank you to our speakers and sponsors. And now I'm going to go ahead and turn it over to Akash.
Thank you. First off, I wanted to thank everyone for joining us here tonight at our headquarters. Super excited to moderate this panel. We have a really unique set of speakers in front of us, three leaders of some of the most important health systems in our surrounding area. First up, I wanted to introduce Maria Romeo. She is the Assistant Vice President of Revenue Cycle Operations at Northwell Health, and previously has held leadership positions at Optum and Staten Island University Hospitals.
I have been around revenue cycle for quite a long time, and I have seen the evolution. And, right now, my main focus is front-end patient access registration for all acute care facilities in the western region of Northwell. And I have seen even the evolution of patient registration as well. So much going on right now. So lots probably for us to talk about.
Yeah. And for the folks that aren't as intimately familiar with patient registration, do you mind just giving me a quick sentence on what that encompasses?
No, of course. So patient registration, right? So, scheduling could be at times the first point of contact for patients, but typically patient registration is that first friendly face that you see when you come in for services at the hospital, the emergency department, if you need surgery. So those are the folks that are meeting and greeting your patients, your family members, the people that we all love.
Thank you. Mm-hmm. Next up, we have Sal Brown. Sal is the SVP of Revenue Cycle at Mount Sinai Health System. And on the proverbial streets of Revenue Cycle, people refer to Sal as the triple threat. Can you tell us why they refer to you that way?
So, correct. I am the System Vice President of Revenue Cycle at Mount Sinai. I've kind of been all over the place. So I've done nonprofits, I've done for-profits, I've done private equity, I've done publicly traded organizations, I've been on the hospital side, I've been on the physician side, done ambulatory, what else? I've done consulting as well. I've been on the vendor side. So, and strategically, I wanted to do that because, I felt like it would enable me to see revenue cycle through the lens of a variety of different avenues. So, when I'm looking to make a decision and I'm looking to take a problem and arrive at the best conclusion, I can pull from a variety of channels and avenues to arrive at the best, decision and conclusion. And my boss is sitting right here, and she is in the front row, and she is beaming me, so I better say everything correctly. So,
I could not survive without that.
Thank you.
Amazing, I love that.
Sal, I had a question for you. So being newer in the New York market, just curious from your vantage point, what makes New York uniquely complex when it comes to the revenue cycle landscape?
Nothing about revenue cycle in general is unique in New York. What is unique is the complexity, the multilingual patient population, you might have a payer that has 50 different variations of contracts, right? That's what makes, the New York market super complex. We all do the same things, right? We register patients, we schedule them, we do insurance verification, we get the authorizations, we code, we bill out. That is all the same across, whether you're a metro area or, a rural area. But again, what makes New York complex is all of those, specialties. And I feel like if you can do revenue cycle here in New York, Everywhere else is like junior varsity.
That is.
So why not?
Yeah. And Sal's from Philadelphia, so we're not going to talk about basketball today, since the Sixers are losing.
We were talking about this earlier,
No.
and let me remind him what happened with the Celtics, right? So it's not over. It is not over. So I would not boast just yet.
All right, and last but not least, we have Aaron Miller. Aaron Miller is the VP of Revenue Cycle Integration at Hackensack Meridian. Aaron, you have a very unique role within the organization. Please tell us more about your work today.
I am at the network level at Hackensack, and I oversee cash posting. I oversee vendor management office. I oversee a revenue cycle project management team, a revenue cycle informatics team, and training and quality. So we are kind of the glue that brings everybody together from access to HIM to the back end. We're helping to prioritize projects that are bringing in revenue or are bringing value to the organization through efficiency. So my team kind of steps back, looks at the whole thing, and tells us where we're going to focus our direction and guide us through it.
And could you tell us more about where you've chosen to have standardization across your system and where you've intentionally allowed variation across Hackensack?
Sure. So when I got to Hackensack, I've only been there for a year and a half. I previously was at Montefiore. So hi, Montefiore friends. I jumped over to the other side of the Hudson, but we were undergoing an epic refuel. So Hackensack very quickly came together with many hospitals up and down New Jersey, and there was a lot of complexity, regionally based workflows, and so we really identified a need to do Epic Foundation and go back to basics so that we could set ourselves up for success. As Epic came forward with new automation and AI, we were too far behind and not prepared enough to scale. And so even in the vendor landscape, we had to really think about, how do we drive efficiency through not having 10 bad debt vendors and simplify the process. And so during the Epic refill, we were looking at our Epic master files, our payer and plan, and we knew we had to simplify that. And we went a little bit too far in the other direction. We standardized it enough where we had enough unique plan mapping so that only one eligibility response came back from for the registration team member to select from. But in our home health and hospice area, they were seeing too many from before. And so we're putting a bit of a wall back up, but we're creating governance still within the payer and plan structure to make sure that if they're looking for a new plan to be created, if they're needing something new, they're first coming to that governance committee and talking it through and leveraging what we've already got made.
Thank you. Sal, as you and Deb joined Mount Sinai in the last calendar year or so, you had this vision around an exceptions-driven revenue cycle. Tell us about what that means from like a 5-year vantage point and how you actually crawl, walk, run to get to that vision.
Yeah, I think what we were looking to do was to take processes today, not just for the sake of standardization and automation, and actually we're trying to move past automation to really get to that exceptions-driven model. So, revenue cycle today, there's a ton of manual processes, which we all know from front to back. And we strategically looked at and broke everything apart. And we said, okay, what's happening today with the health system? What's working? What's not working? We looked at things holistically. And if you know anything about, Mount Sinai, and it's all public, we have a 3-year plan. But we really took fragmented processes today or historically, and we moved to a center of excellence or a center-led model. And the goal for doing that was basically, ownership and accountability. We want to continue to grow. When you have, various different RCM teams, different SOPs, different, processes and policies, different leadership teams and structures, different KPI, metrics and definitions, that doesn't lend itself to ownership, accountability, and scalability. So we really looked at, our core. So we took a look at our vendor ecosystem as well. We figured out, which vendors were producing and performing, which ones weren't, and we brought in, new vendors. That's going to be a continuous, evolution. We did take a Epic first approach. And how I like to think of Epic is, Epic is really the foundation, but Epic is not in every room of the house. So we're looking at vendors not just for the sake of, do they have a prettier dashboard than like Slicer, Dicer, or Epic, but do they really add value and bring any sort of different outcomes to, our performance, and whether that's cash acceleration or, patient satisfaction. So we look at it holistically, and then, we try to bridge those gaps with the technology we already have and paying for, and then also additional solutions that's out in the market. And then we're continuously looking and, checking the market, doing a post check with, who's new, who's innovative, who's creative. And we want to make sure that we continue to scale and innovate.
Maria, earlier you were sharing that across Northwell, you guys have at least 5 different EHRs, if not more.
Oh, yeah.
And was thinking about how you guys are employing standardization, particularly across patient registration and access.
Yeah.
What does that look like in practice when you're operating at that scale across so many different systems?
We have been on a journey to work towards a centralized model for revenue cycle. So historically, your registration, your financial counseling, your business office, all of that was decentralized. So we have spent some time bringing all of that into one centralized model. The biggest thing that I heard over the years was, and again, from our registration team members, was the complexity of having to use, and I'm not kidding, there were some locations where registration team members had to use 11 systems. That's right. We know it. 7, wow, okay, so you got me beat, Leah. So that's a lot. And that's a lot for team engagement as well, right? You're really you're not setting up these people to be successful. You're not giving them the tools that they need to do what they essentially want to do, right? People come to work with a purpose. They don't want to do a bad job. And so throughout this transformation, yes, we have now with Epic has afforded us that ability to really be on a consistent platform. We just did wave 1, which I know most of you
Congratulations.
know. Thank you. That was my wave. Yay. So then, and now we're moving to the central region, wave 2, which is May 30th, and the wave 3, and we will probably, hopefully, continue the centralizing all of the operations and standardization, and which has been so beneficial. We can continue to talk about that. I'm not sure what you next. When I say beneficial, I mean KPIs and processes. Yeah.
And I think one of the core parts of your answer was around learning and development amongst your team. And Aaron, I know that's a key part of your role around creating the training program within Hackensack. Any advice to the leaders in the room around what that looks like and what the best practices are to stand up a new program?
Yeah, so I think where you can make sure your trainers have available time to content create is really important. So using tools that kind of give the onboarding process a little bit easier. There's some nice systems out there that will do that with little webinars where there's testing at the end, and then your trainers are now freed up to really deploy into arenas that are more focused. Okay, now we need to make sure you understand the workflow that you just learned in Epic, because they should be teaching why you're pressing the button, not just how to press the button. And you find that the IT structure of the training is mostly Epic focused, but a real true revenue cycle team is really driving into why, and then having a quality team that backs it up and really digs into finding where there's areas of opportunity, where are their teams struggling through auditing them and then doing targeted reviews and saying, okay, seems like all the denials are coming from this one particular ED on the midnight shift. Let's get in there and do a micro learning or something like that.
And I'm so sorry. Can I comment? So I just met, we've met, but I learned that Erin and I have education in common for front-end revenue cycle. And I would agree with you 100%. Most of the education is focused on the system, right? Like you said, but everyone wants to know, what does that mean for my operations, for my day-to-day, for my interacting with the patient? And I think those programs, such that you have, Erin, and also over by me at Northwell, really empowers our frontline team members to know the direction that they need to be going in. It's not easy, right? And so any type of quality support and targeted training is priceless. So I need to call you.
So I met these two ladies tonight for the first time, and it's interesting because we're on a similar journey. So I will be calling you because we're creating a MSU, or Mount Sinai University, and the premise is very simple. So it's to create pathways for our current staff, but also we're across from Grand Central Station, our business office, and there's a Starbucks on the ground level. But the idea is to take a Starbucks employee and be able to train them and teach them the ABCs and 1, 2, 3s of RCM. So through this Mount Sinai University, that's the goal. So it sounds like you guys are well ahead. So we'll be picking your brains.
Gotta create those career ladders for
There you
them so
go.
they understand.
There you go. So it's exciting.
Wonderful. Well, one of the next topics I wanted to cover and ask you guys about is just like your technology strategy in an Epic world, which Sal, you sort of alluded to, where Epic continues to expand its capabilities, and many organizations are still taking an Epic first approach, but relying on third-party tools. I was wondering, from your perspective, where has automation or AI meaningfully changed outcomes and not just efficiency metrics? And how do you figure out where to dedicate your roadmap as you think about what vendors are doing versus Epic?
Yeah, I would say, Epic is a very powerful system and tool, but it can't be everything to everyone in every department, right? So, it can't possibly innovate across front, middle, and back and all the areas, right? So, we look at any sort of augmentation. We look at technology and vendors that can really add value to our bottom line. We try not to just create another vendor login, and we approach it from a couple of avenues. So one is what's the outcome? What are we expecting? What are we anticipating? Is it going to reduce our bad debt, right? Is it going to accelerate cash? Is it going to reduce denials? So I would say we typically approach it that way first, before looking to bring in any additional vendors. In terms of automation, same thing, right? Because the one thing you don't want to do is automate just for the sake of automation, right? You don't want to standardize just for the sake of standardization, because what typically happens is if you have not created and fixed your workflows, but you've automated them, you now have, congratulations, you've now digitized chaos. So that's first and foremost. And those are the things that, we look at in terms of automation and wanting to ensure that, again, anything that we bring in, any augmentation that we do for Epic, it has a tangible value that we can assess later on and say, okay, was the juice worth the squeeze? And when I get those monthly questions about, hey, how our vendors are performing from a certain someone in the audience, I can point to the KPIs and the metrics and say, hey, these guys and gals are doing well.
I ask more questions. I say, is it what's on the roadmap for Epic? And if it's on the roadmap, how soon is it going to be here? And what is it going to look like? How good is it going to be? And then I go back to the vendors and I talk to them about what their offerings are. But my biggest thing with finding the right vendor is making sure they're willing to collaborate and partner with us. I'm going to hold them accountable, but they also need to hold my team accountable. If my team is not showing up in those meetings prepared to ask questions and talk through the KPIs and the metrics that they're showcasing and challenge them on root cause of that and helping us fix things upstream, I don't want them at the table for us.
And Maria, as you are undergoing, phases of Epic go lives, how do you? That's a multi-year process. Do you totally pause new technology adoption, and how do you think about layering in tools alongside Epic when you're going through a large scale migration like that?
Yeah, so I don't. But it's too soon, right? So we've got to stabilize throughout the entire health system. But what I would say is that, clearly there is a need for AI to a degree. Also, what I would say is that there's and I envision AI helping, and we're really trying to find our way through reporting. And I'm certain that whoever works in an Epic shop knows that reporting can be a challenge. I don't know that it can give us everything that we need. But we're working our way through that at Northwell. But one of the things that I would say for me personally, what I know about AI, I envision like these amazing things that AI can do for reporting, as in automatically giving us our trends and our visuals and our, I mean, I know we use Power BI and all of that, but right, Tableau, but like I envision this really giving us truly what we all as revenue cycle leaders dream about. Yeah, but too soon. So we'll get there.
Can I add to that?
Please.
Oh, yeah.
Artificial intelligence really gives us a fighting chance, right? When you think about, again, going back to the complexities, this payer wants things this way, this payer wants things, this way. The sheer volume and magnitude of, the administrative burden that's on the providers, it's virtually impossible to get to on a day in and day out basis, right? So by having, a system that can quickly sort of spin up and look at those themes and those trends and can spit out like, hey, here's where you got a problem, right? So going back to the ED at midnight or at this location, looking for those themes to empower and equip us, as leaders to really, really take action relatively quickly and address things, further upstream. So it allows us, enable us to move from, reactive to now proactive. So that's, part of the benefit with this, AI wave.
And how are you actually using AI to monitor changes in payer policy and payer behavior and use that to prevent repeated mistakes over and over again?
Yeah, well, first off, I feel like every vendor now, you meet them and it's not even like a hello, my name is. It's like AI, right? So everyone has it. It's about figuring out what's fiction, what's fact, and deciding what's best for your organization. So some of the use cases today is sort of helping us to reduce those manual, very, very tedious, tasks, and, allowing our staff to focus on more complex, higher yielding, activity. So those things like, medical record requests or something like that, we really don't want the teams to work. Those are things that can be, automated, but other things that are more complex, such as, creating appeals, sending those out, checking the status. I know there's companies that do that now. Even Epic has AI, appeal generation letters. But those are all the things that would, allow us and our teams to focus on really the higher yielding activities that's going to really move the needle to the bottom line.
Aaron, I know Hackensack has always been a very technology forward organization, and one of the first health systems in the area to have like a full AI team under the chief AI officer. How's it impacted just the way your team thinks about building internally versus building externally?
So within Revenue Cycle, we've created a governance around this too. We're working on our governance and kind of making sure that we're deploying it, appropriately. I mentioned at the beginning where we underwent a journey of Epic First mentality, and thinking through regional-based workflows and trying to scale them up to more of a network level. And so we can't digitize chaos. And so we have a core group within Revenue Cycle that partners with our team in IT and kind of fact checks the value of something before deploying it. So if it's an RPA bot, is the workflow going to work? Who's going to monitor it to make sure it doesn't break? What is it doing? What's the value? Is there revenue generation from that? So we're kind of like prioritizing ourselves in partnership with that team, while also keeping that Epic First mentality in mind of what's coming, because we don't want to waste time or our team's time building something that is maybe right around the corner.
Yeah. Do you mind giving an example of a workflow that you were able to automate and what that process was like?
Yeah, so we had a payer in New Jersey that was doing site of service denials. And of course, the remittance just came back with a vague no auth denial. And we were trying to capture the loss associated with that so that we can use that in payer negotiations. And we were able to create a bot that just simply went out to the payer website, screen grabbed and said, okay, this is related to site of service, and pull it back in for tracking. And then we flipped it on the end and did it in the authorization side to make sure that we were catching it before it even got in the door.
That must have been pretty game changing for that
Cool.
team.
Yeah.
Yeah. Sal, you were talking about how, someone in the audience asked you about sort of vendor impact and how you can use that to continue justifying working with partners. I feel like Mount Sinai, as well as Northwell, has always talked about labor shortages being a big bottleneck for growth. How do you think about automation as a way to expand the productivity of team members as opposed to just AI to reduce team members and staff headcount?
Yeah, so first things first, we did not introduce AI to reduce any headcount. The strategy was to, as I alluded to in the beginning, move to an exceptions-based RCM model. So again, having the teams to focus on those higher yielding activities, right? Not just going out to a payer website and doing a status or a claim check. So first things first, we really looked at it again holistically. We wanted to ensure that and measure, the success of it. What are we trying to fix? And then ultimately track it all the way through, right? To ensure that it's effective, ensure that it works for everyone. It's a multidisciplinary team, so we involve and include our ops leaders. We bring in our IT groups as well. Quite a few areas, look at in terms of governance, what we're doing, and they ultimately sign off on it as well. But when we think of AI, we really think of it as, again, going back to giving us a fighting chance, right? There's a lot of noise in revenue cycle, and we feel like some of those tools can help us to separate and isolate, the noise versus what you actually have to do to move the needle.
If I may, I have a.
Please.
Come on in.
I actually am. We have like a chat GPT behind the firewall within Hackensack, and I'm actually using it with my leaders to help hone their skills, their leadership skills, because they were, newer managers and really struggling, and so they can use it as a scripting tool to navigating like complex employee issues and creating, team charters to help build the vision of their team. So that way their time is, not as much focused on that type of thing, even though, that stuff is important. It's helping them be more strategic in where they're spending their effort and time. So they use it for scripting. They've used it for helping score evaluations to ensure that if someone's going to get a 2, they understand how they get to the 5, what are the different ranks. And so it's really cool how we've been able to skill up our managers.
Oh, wait, so I have one more. We're Epic. Our learning and development team also created a chat bot, and they basically fed it every single job aid, process, workflow, anything that potentially a registrar could ask. They will find it directly there. They're so smart, and they really are. Yeah. And, with the prompts and all of the techie stuff that maybe some of you know, but they were amazing. And like, this has really been a very received well from the team members, and very, very, a high engagement factor that, was just, again, giving them resources that they need to be successful, especially during this stressful time of an implementation. So I love that.
Shifting gears into sort of our last topic for the evening, and then we'll open it up for questions. We wanted to talk about leadership, talent, and the next generation of RCM. Maria, I know you're very publicly passionate about management, leadership, and developing really strong people under you to continue building on the vision that you set forth in your organization. What's like the key to building a really successful team, and how do you think about leadership at large?
Yeah. So mentoring is so important. I had the best mentor in the whole world. She's in the room, but she knows who she is. And time, being generous with time as a leader for your team, to me, is the best thing that you can ever give someone. I am really passionate about creating, listen, I've been here, right? So I'm very passionate about creating the next generation of leaders, really passing on, the historical knowledge, the present knowledge, and seeing what those folks can do. And I am right now, I have a great team. So I am so fortunate. It's because of them I can come here and do something like this, right? If your team makes your job easier, they're amazing. So just mentoring in time, exposure, giving them stretch assignments, all of those things that really help form someone's experience over time.
Sal?
I would say we look for RCM leaders who are translators. When you think about our industry and how quickly it's changing, the days of, hey, I've managed AR for 20 years is no longer, right? So we look for folks who can simultaneously, know not just revenue cycle, but operations, finance, technology, right? So we look for leaders who not just know AR, but also can speak APIs. So I think that, the industry as a whole, and with a lot of the innovation that's coming and that's already here, it's kind of forcing us to think a bit differently and think more strategically about, our hires. We're hiring folks who, sometimes don't have traditional healthcare backgrounds, right? We find folks from fintech who can make, great impacts to, the organization. So, I think from our perspective, we're looking at, additional hires with additional skill sets to help us to elevate our revenue cycle and continue to take it to the next level.
Erin?
I'll echo everything you said, and I'll also add, we're on a journey of encouraging our teams to be more curious about data, kind of be a bit more self-service and using Slicer, Dicer, and Sidekick to challenge themselves to dive in deeper. And so we're looking for people that can do that and pull from data actionable insights, and then be bold and confident enough to go out there and ask the right questions to find out why something is the way that it is. So people that can do just that, maybe they're coming from a different, walk of life, but as long as they're showcasing to me that they're confident to dive in, drill in, and then go on a rodeo show to find out where the problem is, and then challenge the status quo and tell them why and bring them along in the journey. So people that can do that is really where it matters for me.
And when you're building out your team, how do you balance like technology fluency as a skill set versus revenue cycle fluency as well?
Yeah, I mean, I'm thinking about my informatics team hires. It's a new team that we're creating, and I have my first hire finally. He has a master's in data and analytics or something fancy like that. SQL, but he worked in Access, and he worked his way up from registration and into an analyst role within patient access. And so I'm challenging him to dive into, okay, now why is there an eligibility denial coming in? So they have a mix of that background, and they're willing to put themselves out there and learn new skills and technology, and they're not just going to step back and say, all right, it's already always been done that way. It's okay.
Given the sort of the head nods in the audience, I can tell there's a lot of questions and folks wanted to chime in as well. But I wanted to end with one question before opening it up, which is if you could just share one lesson that you've learned leading through revenue cycle disruption, and how has that shaped you as a leader today?
I'll take it first. So the biggest thing, again, being new to Hackensack, was right away we recognized the need for collaboration. They had scaled very quickly, and there were a lot of silos created within different teams. And so immediately we created task force that were cross-functional with like UR, HIM, finance, managed care, to make sure that everyone was at the table. And there are different task force focused on different things. One's about payer performance, one's about underpayments, one's about denials. And so there are all walks of life within that room, within, the different teams, coming together, collaborating on that. And so for me, I think the biggest thing is collaboration.
Let's go in order. I would just sum it up in sort of 2 words: change management. That is key for us and any organization, right? Because you can have the best intentions, the best plans, the best strategy, but if those areas, whether it's clinical areas or ambulatory or whoever, right, if they don't understand the plan, the why, right, the benefit, right, you're kind of dead on arrival. So by ensuring that everyone knows what the plan is, they understand, they're bought in, that makes life so much easier. And trust me, I had to learn it the hard way.
Thank you. Maria?
Yeah, I will tell you that just today I was on a meeting where someone asked us what DNB was. Standardization is good. We still have pockets of business that is not. And again, they're looking for that information. People want to do the right thing, but you have to bring it all together. It's not easy. It's for large organizations, it's hard to do.
Bunch of people pulled out their phone to go and Google what DNB is now.
Yeah, they all know.
Please join me in a round of applause for the 3 speakers.